I want to introduce our guest of honor, Dr. Thomas Lee. So most of you don't know this, but I first met Dr. Lee. Actually, I didn't even realize that we hadn't met in person.
Right.
It felt like we had met in person. We were together on Zoom. We were, Claudia and Dr. Lee and I were taking place in a debate with the president of the American Psychiatric Association at the time, and Dr. Rebecca Brendel. It was October 27th of 2022. And it was a webinar sponsored by the Cato Institute. And guess what we were debating? We were debating the efficacy of prescriptive authority psychologists, and the psychiatrist was Clark. Psychiatrist, she didn't have a lot of good, important things to say, right? But Dr. Lee did. And Dr. Lee was our champion psychiatrist, standing up for us and the efficacy of what we do. And because of all the teaching and the training that you do, you know us very well and know that we are certainly at high competency levels to be able to prescribe. So most of you who do know Dr. Lee, because you've trained under him, so he has been the principal clinical supervisor at the Ascension Alexian Brothers Behavioral Health Hospital. We go through so many different name changes.
Yeah.
So I think that's our latest name. And you were in the Prescribing Psychology Fellowship, and that you were one of the first psychiatrists to be involved from its inception. So I have so much to be grateful to you for. You have trained most of our 22 practicing prescribing psychologists in Illinois, and so you have said to us that training the RXP fellows has been one of the highlights of your career. And so we're so grateful, so grateful to you. And we have several students and friends and colleagues of Dr. Lee here to thank him, to honor him for your dedication to your beloved field of psychiatry and for generously sharing your love of your work in the training of us. Clay Chia, I think Clay, there you are, Clay and Laura. So Clay, I'd like to give you the floor first. If you would speak, Clay, the president and CEO of Ascension Alexian Brothers Behavioral Hospital. And if you could say a few words for your very close colleague, that would be fantastic.
Okay. Well, I just want to say that Dr. Lee has been a pioneer. We've had the opportunity to work with a lot of doctors and Dr. Lee has stepped up and been able to allow us to really move this prescriptive authority forward. Before him, we had to work very hard to find different psychiatrists to fulfill that portion of the educational role. And it's just been a joy to see the number of individuals that he's been able to work with, the number of lives that he's been able to touch as a result of that, and to really take a look and say, you know, there's several of us that have the idea of how to get something done, and then there's somebody that can really step up and do the work. And that's what Dr. Lee's been able to do. And the entire movement is really grateful for his dedication and being able to stay focused for all these years with our clinical psychologists. So it's my real pleasure and honor to have been working with Tom for these years and to see him tonight being able to receive this really distinguished award. So thank you, Tom, for everything you've done at the Center for Mental Health, for Ascension Alexian Brothers, and for your pioneering work with the Illinois Association of Prescribing Psychologists. We are forever in your debt.
Thank you, Clay.
Thank you so much, Clay. And now Dr. Gretchen Bowles, who is the fifth prescribing psychologist in Illinois, and I want to get this right, the program manager of the RXP Fellowship at Ascension. So I'm so delighted. I mean, you've done such a wonderful work at setting up the program and making sure that all of our fellows, prescribing psychology fellows, have their supervisors in the various medical disciplines. You've just done a fantastic job with that. We're so grateful to you
Thank you.
for that.
All right, thank you. Thank you very much, Beth. I'd like to thank you first for your warm hospitality and welcoming us into your home. It's always a pleasure. But thank you for your incredible vision, perseverance, and tenacity. We would not be here without you today. And I think there was a psychiatrist friend of ours that said that you're a true rainmaker, which you are. Thank you. And without Beth and without Clay's agreement to take us on, we wouldn't have had the meeting with Dr. Lee. And Dr. Lee, he afforded us the opportunity to actually become prescribers. Dr. Lee is a highly astute clinician, and we couldn't be more grateful. Dr. Lee embraced RXP in 2017. Even with his own challenges, working virtually out of a wheelchair, struggling with muscular dystrophy, and still working with our most vulnerable psychiatric patients, Dr. Lee agreed to be our primary preceptor in psychiatry, and he also helped develop its program from the infancy. Dr. Lee is a board-certified psychiatrist who's always had the drive to help others, and I love his story that he started at a very young age working as a dishwasher, I think in a hospital, then entered the world of nursing, and you were an emergency room nurse and an ICU nurse for years. Then Dr. Lee ventured off to medical school, Oral Roberts University in Tulsa, Oklahoma, and then did his residency at Loyola. Dr. Lee has had various roles in the field of psychiatry, medical director for 12 years at Silver Cross, as well as a consultant on the medical floors. He is specialized in treating adults with intellectual disabilities and comorbid psychiatric disorders. He also specializes in treating bipolar disorders as well as other affective disorders. And Dr. Lee, even though you will not be treating patients as you retire, you will not be actively in the trenches, your legacy will live on through all of us, all the fellows that you've worked with. I think I can't even keep count anymore. There are 22, 24, and there are several of us that are not quite licensed yet. And that we'll continue to help others as you helped us, as you pass the baton. We fellows will always treasure your wisdom, your great sense of humor, and your delight in teaching and training. We will also remember all that we've learned from you. One, we'll never be able to measure how you've helped thousands of individuals, either directly or indirectly through us. The ripple will carry on through the years. Dr. Lee, we fellows are grateful to have had the opportunity to call you our mentor. You are a person of the highest caliber, with the warmest heart and the brightest mind. Thank you for the last 8 years of guidance and wisdom. And as you retire, we hope that you go off to your beautiful family, enjoy your life, your time spent with your family, grandchildren, I believe some great-grandchildren. So God bless you. Thank you. And I think there's some people that would like to say a few words, some other fellows. Kyle.
Dr. Kyle Bonesteel, the Illinois 7th prescribing psychologist.
How do you follow that? Wow, Gretchen, thank you so much. That was so beautiful. I feel, and I know we all feel, honored to be able to honor this great man. Dr. Lee has shown us what it means to give generously of one's time, one's wisdom, and one's experience. Never for recognition, always for the betterment of others. His influence extends far beyond his own patients and even beyond his own generation of work. At a point in his career when many might step back, he leaned forward in a very, very big way. He chose to invest in a new wave of providers, prescribing psychologists. As Gretchen alluded to, if we look at the deeper meaning of the word mentor, we will find that it extends beyond just professional guidance. It is said to encompass a transformative relationship characterized by mutual respect, growth, and personal development, which fosters empowerment and a realization of one's enhanced potential. Dr. Lee, your mentorship reminds us that true legacy isn't measured only by what we achieve ourselves, but by helping all boats rise. The transformative relationships that you have cultivated in the prescribing fellows will ripple. There's that word again, ripple. It's funny you mentioned ripple. It will ripple forward in every patient, Dr. Lee, that we care for, in every life that that care touches. I and we all are forever, forever grateful. Tell them they can wait. Yeah.
We're shutting the sound off.
He's my buddy. And on that note, I want to share with you the top 5 Dr. Lee gems. Now, these are little morsels, little nuggets of wisdom and insight that I have, witnessed as he masterfully treats his patients and provides them what they need when they need it. It's really something to see. But in descending order, number 5. You can feel alone, but you can't possibly be alone. I love that one. You should see how that resonates with his patients. And by the way, he hasn't trademarked any of this or copyrighted it, so I use them every day in my practice, and I feel so smart. Number 4, you don't need to give up control. You need to give up the delusion that you had any control in the first place. I love that. Number 3, simple but profound. Nothing changes when nothing changes. Number 2, there is a difference between doing better and feeling better. And number 1, as a man of faith, that Dr. Lee is, God grant me the serenity to accept the people I cannot stand. The courage to change the one that I can, and the wisdom to know that's me. And I have one more bonus gem that's only going to make sense to the fellows, okay? Oh, happy day, another blessed subtraction. Right? Good. Dr. Lee, we honor you, we give thanks to you, and each and every one of us is better because of you.
Thank you, class.
Dr. Cindy Steer.
I know. That's wonderful. How are you? Good.
I'm going to say one thing, and the rest is in this card for
Thank
you. This man, as Gretchen said, this man has a mind like no other. And he would let us ask him any question about anyone, even if it wasn't supervision hour or anything. And so this poor lady who was suffering so greatly with this horrible eye disease, who I was treating in therapy, he asked me about a medication for her, and I said, well, she said that her doctor said it had the same mechanism of action as something she'd already tried that failed, and so the doctor didn't prescribe it. And he said, oh, no. The mechanism of action is different. They're a similar drug, but, and he went on to explain something that an eye doctor specialist would know. And so I told the patient that, and she talked to her doctor, and her doctor prescribed the medication, and night and day her life was changed. So God bless you, and thank you so much. And that is truly what it means for all of us to work collaboratively using a biopsychosocial spiritual
Very good.
model.
Amen.
Thank
Thank you, Cindy.
And Cindy is our most recently licensed prescribing psychologist. In Illinois, technically number 23, but really the 22nd prescribing psychologist in Illinois. Dr. Ken Kessler, number 11, I think, is that right?
14.
14.
License is 15 because
Okay.
they have phobia of 13 down in
Right,
Springfield.
right.
So
Right, yeah.
every profession, 13 is always the test license. So no one is number 13.
It was supposed to be my number.
It was supposed
Right.
to be your number.
That's right. That's right.
That's right. Well, Tom and I met. I think I followed Kyle in the clinic, so we all started at the clinic, and then Tom and I spent a lot of time together, more than most of the other fellows, because I was a little remedial on a few issues. No, I'm just kidding. I did have one problem on one rotation. So didn't do the right things.
We're squattered up behind that.
No, never. No, that I didn't have trouble on that rotation.
There's some in conversation going on
Oh,
right
yes. Well, I had a little trouble on one rotation that I didn't. Something happened. I didn't get all the hours I was supposed to get. I put them in, but the preceptor said, "Well, I don't think you can get all those." So then Rocco said, "Well, Rocco DeMonico was the director at the time, and he goes, well, how many can you give them?" And he goes, "Can you give them 40?" And she goes, "Yeah, I can do 40." So that we left the meeting, and then we said, Tom knows about this meeting. Rocco said, "Well, we got to do another 20, Ken." I'm like, "Okay." So we did.
Hardworking, our hardworking prescribing psychology trainees.
That's
That's
right.
why we're so good.
So we did the other 20, but Dr. Lee and I have spent a lot of time together and gotten to know one another, both as a mentor and friends, and really look forward to all of our chats and Zoom meetings. And we've developed a very good mentorship and friendship. There is never a single question as the others have alluded to. I was just talking to Noah. You can ask him any question about anything in medicine, and he'll know the answer. It's very unlikely that he would have to Google it or anything.
Thank God for Google.
Yeah. Well, you must be able to Google it real quick because you could come up with it right off the top of your head. So he's taught me a lot about psychiatry and a lot about medicine, and not only psychiatric medicine but other medicine, being in general. And I've really valued the fact that we got to meet each other and we've gotten to know each other over the years. So thank you.
Thank you, Ken.
Anybody else would like to say something?
I would.
Yes, Dr. Mary Talon.
I know Dr. Lee in another capacity. He has been so generous in teaching my family physicians about psychopharm. And they have been struggling to find a good, where do we go? Yeah. Here. A good psychiatrist who would help them think. I mean, they are the gatekeepers for primary care mental health. And Dr. Lee has been absolutely opened his doors and let our family docs see the world of psychiatry and be able to have him as a resource. So I am so grateful for your time and your openness to work with my family physicians.
Thank you.
Dr. Nancy Healy-Haney.
I just want to give you a personal thank you. I
Yes,
trained,
microphone.
I was with Dr. Walsh, as you know, but I used to love to scoot down the hall to your office, and every time I had the opportunity to really be with you was a joy. I started as a nurse, as you know, and I just really went through all your nursing career. I had to know everything about it, and then I had to know what your ER experiences were, because I did that too, that horror show. But anyway, then we went on from that, and we actually did get into psychiatry. There's no doubt about that. But I want to tell you that I was never afraid to ask you anything. And, you know, from that professional point of view, it was just so helpful because you feel very reticent. And I really did. I just love the clinical conferences you did. There were very few of us. I think there were 4 of us in the clinic at the time. I'm number 8. I don't know if I managed that. But anyway, because there were just like 4 of us. And so, to sit with all the doctors was pretty intimidating. And I tried not to be, but I was. But I never felt that way when you met with us alone. And we did ask stupid questions, there's no doubt about it, but it felt good to be able to do it because, frankly, if you got the answer, you felt more confident when you walked out of that door. So I'm really sorry you're retiring. I really am. I'm sorry for your patients because I know the ones you've been seeing. And oh my gosh, they're on real heavy duty medications. And I think that's where I picked up a lot when I really got into antipsychotics. And I have a ton of psychotic patients. Every time I see one of them and I'm looking at their medication regime, and I'm like, I don't know that this is altogether right. But anyway, thank you so much. It made a tremendous difference in my practice. And I want to thank you very much. And good luck to you and good health. And thank you for your perseverance in coming in on those winter days. I thought, my God, I guess I could come from Wisconsin if he can come in a wheelchair. All right, thank you again, and blessings.
Bye-bye.
Dr. Katerina Lenzo, would you like to say something?
So I felt really blessed that you became my mentor, my supervisor, and I hope a friend. It was a really gentle introduction to applied psychiatry. And at times, I really felt like you helped me to manage my anxiety and my doubts about being ready and know enough to practice this new skill. And I know that whenever I step into that role of a prescribing psychologist, I'll have that voice in my head guiding me through difficult times and difficult cases, and kind of have that phrase, start low and go slow. Thank you so much. Thank you. Thank you.
Thank you, Dr. Lenzo. Number 22, prescribing psychologist number 22. Dr. Lee, would you like to say a few words?
Well, as Clay said when he was giving his words, I really have felt that this was one of the real highlights of my career as a psychiatrist, to be able to work with the prescribing psychologists. I guess, as Nancy was saying, coming out of a nursing background, I've always been very team-oriented in my mentality in medicine. And so it was very easy for me to slip into a role, but it was working with psychologists was something we really don't have much of a place where we encounter each other, other than maybe sending somebody for testing or sending somebody for therapy, but we don't really work together very much. And I was very intrigued at the possibility of being able to work with psychologists. And I was not in the least bit disappointed. I mean, you guys are educated and erudite in terms of being able to talk about, disease states and diagnosis. And, what was lacking is the ability to talk about medication treatment. But you were well versed in those areas of treatment that we know very little about, in terms of somatic treatments or therapy management with states like OCD or, even depression. So I just want you all to know, it's very nice to hear how much you all got from it, but I got every bit as much from working with each of you as you feel that you did for me. And I'm very grateful for the experience. I miss you guys already, the ones that I don't get to see very much. I've always told the fellows that, you all have my cell phone, so if you ever need to text, you can give me a text, even if it's just to say Merry Christmas or whatever. But I hope we can, continue to stay in touch and retirement or no retirement, continue to let our relationships continue.
Wonderful, thank you so much. And I'm sure all of us will stay in touch with you. And we have something for you. So anybody wants to come up, let's take a group picture with Dr. Lee.
Dr. Lee, we have an award for you.
Come on up. You want to come, we can come behind, if you can. And if somebody has a phone, if you could take a picture, could you want to take a picture? There.
So sorry.
Okay, it says Thomas D. Lee, in honor of outstanding mentor to prescribing psychology fellows with our utmost appreciation, IAPP 2025. Thank you very much. That's lovely.
Thank you so much.
Thank you.
So you'll never forget us.
No, couldn't forget you guys.
And you will always be with us.
Oh, okay, sure. Need something to put in.